Endoscopic forehead-eyebrow lift of young people. Today, I'll talk about the need of forehead-eyebrow lift in young people where the surgery is required for many women after middle age. As you can see in the picture, eyelids sag with aging. Actually, this is not the real sagging of eyelids, but eyebrows look sag because of eyebrow sagging. In this case, eye surgery must be prohibited. If middle-aged women have upper blepharoplasty because they think their eyelids sag, facial image will turn strong and rough. Therefore, they must have forehead-eyebrow lift like in the picture. Within young women, if eyebrows are not sagging, which means eyebrows don't affect eyes, eye surgery is possible by itself. By observing upper eye lines, it can be seen whether the eyebrows affect eyes or not. In general, eyeline must be curvy, but this becomes linear shape because eyelid skin droops down if eyebrows sag. If upper eyeline loses its original shape and becomes linear, endoforehead-eyebrow lift must be considered instead of eye surgery. For this young lady, eyebrows don't affect eyes, and upper eyeline maintains the curvy shape. In this case, she can have double eyelid surgery only. This is profile view. This patient had rhinoplasty as well, and this is lateral view. A lot of young ladies have double eyelid surgery in recent days, but it's rare that eyes turn beautiful. The reason is, eyebrows are actually sagging in many cases. As you see in this picture, this person has sagging eyebrows. Upper eyeline became linear as eyebrows sag, and black cornea is covered due to sagging eyelids. Many doctors diagnose this by looking at black cornea as ptosis, but this is just a symptom of eyebrow sagging. If eyes are corrected based on the ptosis, eye image turns very strong and surprised-looking eyes can be illed, and overall image becomes strong. Therefore, in this situation, forehead-eyebrow lift and double eyelid surgery must be performed together. As you can see in this picture, the distance between eyes and eyebrows is the same even after the double eyelid surgery, and this is because this patient had endoscopic forehead-eyebrow lift. This is a picture of another patient. Her eyes make strong image, and upper eyeline is slightly linear. This is because the eyebrows are sagging. There is one thing you have to keep in mind. Lateral eyebrows don't look sag in this picture, but actually they are droopy. This just looks non-sagging by shaving the lower part of eyebrows. Therefore, double eyelid surgery must not be performed if expecting the change of one's eye image. Because eyebrows are sagging, if double eyelid surgery is performed only, one's image turns very strong. Either endoscopic forehead-eyebrow lift or both the forehead-eyebrow lift and eye surgery must be performed simultaneously. It's post-operative view. Endoscopic forehead-brow lift was performed simultaneously with eye surgery, and eyes got bigger, eye image got better, and the distance between eyes and eyebrows maintained well. This person had linear eyeline due to sagging eyebrows. For this case, endoscopic forehead-eyebrow lift is the priority surgery, but unfortunately, she only had double eyelid surgery. If eye surgery is performed solely, image of eyes can be strong as you see. As in the lateral view, it is noticed that facial image becomes too strong. This patient has a similar feature of eyes to the previous patient, and she had endoscopic forehead-eyebrow lift and double eyelid surgery simultaneously. Even with the similar eyes, the final result can be so much different depending on the surgical method. This person's eyelids look sag. but eyebrows sag a lot in zoomed view. Because the sagging of lateral eyebrows, outer area of eyes becomes sag, and eyelids cover cornea as well. But again, it's not the case of ptosis. And take a look how the severe epicanthic fold changes after the surgery. Endoscopic forehead eyebrow lift were performed together as a correction. This patient also has sagging eyebrows, but she only had double eyelid surgery. Image of eyes become very strong and fierce. The order was wrong, but endoscopic forehead eyebrow lift was performed to make eye image gentle. You can see the change after the surgery. This is the opposite side, before and after the surgery. Even with the double eyelid surgery, double eyelids are buried and eyelids look bulged, but with endoscopic forehead eyebrow surgery, the distance between eyes and eyebrows get further, eyelids become thinner, and eye shape turns natural and gentle. Another patient, again, endoscopic forehead and double eyelid surgery were performed simultaneously. If double eyelid surgery is performed solely, eyes and eyebrows get closer and eyelids get bulged, thus overall image becomes strong. Therefore, if eyebrows are sagging, endoscopic forehead eyebrow lift must be performed for the correction of the fundamental cause, and age doesn't matter for this surgery. There is no difference in gender as well. Therefore, remember the fundamental cause, eyebrows and forehead must be lifted simultaneously. Let's look at the change if eye surgery is performed only without endoforehead eyebrow lift. This person has sagging eyebrows. If she had endoforehead-brow lift, other surgeries may not be needed, but she ignored the fundamental cause of sagging and had double eyelid surgery, medial and lateral canthotomy, and pretarsal rule making with foreign body injection. Thus, eye shape was almost ruined and deformed. This is the photo of another patient. This person has similar shape of eyes with the previous case. Like this case, if eye surgery is performed for those who have sagging eyebrows, eye shape is ruined and overall image is destroyed as well. Let's look at the short video clip. I will explain why the endoforehead-brow lift is required for young individuals and what the procedure of this operation is. I reviewed all the photos of my patients from 10 years ago who had eye surgery. As I reviewed hundreds of photos, I was very curious that I couldn't find anyone who looks pretty even though they had eye surgery. What's the reason? This is because I was focused on eyes only in the past. Mostly, people who came for the consultation for eyes probably had problems with eyes. This is because they ignored that they had problems with eyebrows. I missed this point. In general, eyelids look sagging if eyebrows are sagging. This is because they simply had eye surgery. For young individuals, they must check their eyebrows when they visit for the cosmetic surgery consultation. Let's find out the case of having problem with eyes, the case of having problem with eyebrows in young person. Within the shape of normal eyes, upper eyeline must be curved arch shape and lower eyeline must be close to linear shape. When eyebrows affect eyes, upper eyeline turns to linear due to the eyebrow sagging. This is not the problem with eyelids, but it should be recognized that eyebrows are affecting eyes. Double eyelid surgery makes the distance between eyes and eyebrows shorter, and the overall facial image very strong and fierce. Therefore, in this case, eye surgery must be prohibited. Again, eyebrows must be lifted with endoforehead eyebrow lift. Only few people had beautiful eyes among the patients who had double eyelid surgery by me, one must give up having beautiful eyes if performed eye surgery only. Therefore, when eye surgery is performed, the problem should be diagnosed first. It should be diagnosed whether the problem is with the eyebrows, eyes, or both. Therefore, even with the young women, if eyebrows are sagging, never do the double eyelid surgery, but instead do endoforehead-eyebrow lift. And simultaneously, double eyelid surgery is possible, and having double eyelid surgery only ruins the facial image. Endoforehead-eyebrow lift for young women is performed using endoscope. Let's talk about procedure. There are some downy hair between forehead skin and scalp. The incision is performed vertically from this position inside the hair, and incisions are 1 cm in the middle, 1 cm each on both sides, following the line from the highest position of the eyebrows. Through this incision line, dissection underneath the skin is performed using endoscope. The key point of this surgery is not just pulling of eyebrows and forehead. There are muscles which pull the eyebrows downward. With frowning, eyebrows gather inward and droop downwards as globular frowning folds are formed. Then, those muscles which pull the eyebrows downward and make the globular folds will be cut assisted by endoscope. You are watching the video clip recorded with endoscope to cut the globular muscle. After that, eyebrows and forehead is lifted naturally. Thus, natural facial expression can be achieved. Sometimes, eyelids get thinner after endoforehead-eyebrow lift due to shortage of orbital fat. If fat is lacking, eyes feel tired easily in the afternoon. Therefore, if eyelids are depressed after endoforehead-brow lift, fat injection must be considered simultaneously. And if forehead is depressed after endoforehead-brow lift, fat injection can be considered to fill the volume as well. Sometimes, 3 wide eye can be ill if eyebrows and lower eyelid skin are sagging. This is the case of lateral eyebrow sagging. At the same time, eyelids lost elasticity and sag, thus showing wide part of eyes in 3 directions. Lateral eyebrows and temporal area are lifted after the surgery. Therefore, 3 wide eye was corrected, which means the separation between black cornea and bottom eyeline was fixed. Endoforehead-brow lift can be divided into 3 types according to the sagging shape and the position of eyebrows. The first case is overall eyebrow sagging. In this case, eyebrows should be lifted entirely. The second case is medial eyebrow sagging. People who frown a lot mostly have this feature. In this case, globular muscle and the muscle which pulls eyebrows inward are cut. Therefore, medial eyebrows are lifted mainly. Following are the pictures of patients' cases of medial eyebrow sagging. In this case, medial eyebrows are relatively lifted more than lateral side. The last case is lateral eyebrow sagging. In this case, lateral part is lifted relatively more. I always tell, start the facial cosmetic surgery with nose and complete with eyes. This is the meaning of final touch. Since nose is the basic of facial cosmetic surgery, if any problem is detected with the nose, the problem must be solved. Nose can be described as hardware, where eyes can be software. Most of the cosmetic surgeons suggest, and most of young females want eye surgery first, But since the significance of eye surgery is completeness, thus consider the eye surgery as a top priority is very dangerous. Eyes are a hard area for retouching if it is ruined in the first place. Therefore, one should think how to express the completeness of face, expression, characteristics, and the color. This person has overall sagging features of eyebrows. Check how this person changed when performing endoforehead-eyebrow lift. Other than forehead-brow lift, forehead fat injection, double eyelid surgery, pretersal roll fat injection, and eyelids fat injections were performed simultaneously. 45 degrees lateral view and zoomed views. Lateral eyebrow bone is located in the red circled area, and lateral eyebrows are located immediately above this. This relationship is very important. This shows where the lateral eyebrows must be positioned when lateral eyebrows are lifted during endoforehead-eyebrow lift. Protruding eyebrow bone under the lateral eyebrows shows women's beauty. This exposes the fact that forehead eyebrows lift is required for the one with sagging eyebrows. This is a profile view. Rhinoplasty, fat injection on forehead and chin were performed simultaneously. I already said the surgical method can be changed depending on the feature of eyebrow sagging. This patient also has sagging medial eyebrows, and this makes her angry-looking face. Then, lateral eyebrows should be lifted more than the medial eyebrows so that she can achieve softer eye image. This is another patient with medial eyebrow sagging. If inner eyebrows are sagging, most of them have angry look, and this is a case due to globular frowning. You're seeing how the lifted medial eyebrows affect to the overall facial impression. This is the lateral view. You don't see much difference of changing in lateral eyebrows, but medial eyes are lifted as medial eyebrows are lifted. This male patient is only 20 years old. His overall eye impression looks angry due to the medial eyebrow sagging, and he became having gentle and mild image after lifting of medial eyebrows. Oppositely, this patient has lateral eyebrow sagging. This makes her image sad, gloomy, or tired. She had lateral eyebrow lifting and double eyelid surgery. After all, the person can have live and clear eye image. This is another case. You can see how the overall eyebrow sagging affect the facial image. Buried double fold became exposed, eyelids became thinner, and entire facial impression changed lively. This patient also had eyebrows sagging, especially lateral side, and also upper eyelids were depressed. If fat is not enough on the upper eyelids, eyes feel tired easily, thus endoforehead-brow lift must be accompanied with fat injection on eyelids. This patient also had double eyelid surgery together. In the zoom photo, you can see the lateral brows are shaved. Due to the lack of fat on upper eyelids, fat injection is required. Compare the preoperative and postoperative pictures. Even in the young females, if eyebrows are sagging, means eyelids look sag because of eyebrow sagging, or eye shape is not beautiful due to eyebrows are sagging. The fundamental causation must be corrected by endoscopic forehead-eyebrow lift. No matter how young or old a person is, eye image can be changed only by endoforehead-eyebrow lift. Males are not exception. Many people have double eyelid surgery, but the reason why they are not beautiful is that they didn't correct the eyebrows. Thank you for watching.